We have one more talk before we let you out for lunch, but I wanted to share with you the findings of our last poll. We got some more answers, about 50 answers on this one. And this was, what do you think about deal valuations in MENA today? And the number one answer with 57% was deals are overvalued, we are in a bubble. However, about 43% thought otherwise. They thought that deals were, fairly or undervalued. Fairly valued was 27%, and 16% of respondents felt that deals are undervalued and the sector's growth is just beginning. So, I just wanted to share those with you. And then our next speaker will be focusing on healthcare landscape in Egypt and the opportunities for health tech in the Egyptian market. Karim Khashaba is the CEO of Yodawy, the leading virtual pharmacy chain in Egypt. Prior to setting up Yodawy, he founded Medex Cloud, a SaaS clinic tool for doctors. And before that, he spent 8 years at Booz & Company, or now Strategy and. And welcome, Karim, to the stage. The floor is yours.
Hello, hi everyone. So I had slides that I'm not sure. Okay, so I'll keep it brief. I know it's been a long morning. So a little bit about the Egyptian healthcare market. Usually when people talk about Egypt, they talk about the 100 million population, about the big opportunity, the lack of infrastructure, and so on. And indeed, there are a lot of opportunities, especially in healthcare, but there are a lot of operational challenges as well. Today, the total healthcare spend of Egypt is about $20 billion per year, which is, I think, very similar to Saudi, even a little bit less. And considering the fact that it's 4 to 5 times the population, ultimately this means that the average spend per capita is quite low. So it's actually, if you think about it, a very tough market in terms of healthcare provisioning. It's a no-frills market. Usually consumers are very price sensitive, so very, very price driven. And that makes it usually very, very complex to operate in. If you look at the healthcare provider side, 80% of outpatient consultations today are done in single doctor clinics. There are currently 50,000 pharmacies in Egypt, of which only 2,000 are part of pharmacy chains. So ultimately, really what this in simple terms means, healthcare provisioning and servicing is being run by freelancers in the industry. It's single doctors, it's single community pharmacies who own their pharmacists and so on. And this also kind of resonates well with the no-frills model. It ultimately, at the moment, healthcare in Egypt is a lifestyle business. It's a single doctor in his clinic, it's a pharmacist in his pharmacy, and they're making enough money as just disposable income, as a normal salary in a corporate environment. Now, the first wave of private equity firms that came to Egypt in the early 2000s set up kind of the first wave of hospitals and so on. But generally, it's been very, very tough to build an institutional model when it comes to healthcare, integrated facilities, hospitals, and so on, namely because of the margins and because of the consumer power. Today in Egypt, there are about 7 to 8 million insured members, which means medical insurance penetration is currently at 7 to 8%. So there's a big gap in terms of the sponsor and payer side in Egypt, which ultimately means 60 to 70% of healthcare spend is out of pocket. And to be honest, even if I reflect on myself, growing up in Egypt, no one had health insurance. You'd have to go, you basically pay everything out of pocket. And whenever someone had to do a big operation, it was a problem because it's a big amount. And this is really the environment we grew up in. And insurance only really started to happen in the last 10, 15 years. You had international players like MetLife, AXA, Allianz, all of these come into the market and start to compete with the local HMOs that were in the market. Now, obviously, an environment like this would, I think, create a lot of opportunity. I want to focus on the use case that we as a pharmacy benefit platform are tackling, because it's already, I think, complex enough, and I think there will be players that do this for labs, players that do this for doctor side, and so on. So a typical experience of a patient who wants to get his prescription is he would receive a paper-based handwritten prescription from a doctor in the network of his insurance company, or if he doesn't have insurance, just so. Maybe the first statement is medical records digitization in Egypt at the moment is below 1%. It's basically non-existent, which is a big bottleneck for innovation in my view. Once this happens, it will open up the door for a lot of startups to come in and do a lot of interesting things. So typically, you take your paper-based prescription. If you are insured, if you are one of the 7 to 8 million, then typically you have to look for one of 700 pharmacies out of the 50,000 that are contracted with your insurance company. So it's not that you would walk into any pharmacy and they would serve you. It has to be one, and usually insurance companies give out a booklet that no one reads, and you basically have to flip through it to see which pharmacy you can go to. Typically, you would walk into this pharmacy. There's usually a queue if you're an insurance customer, and even if you stand in the queue for 20, 30 minutes, which, to be honest, is not different than other more advanced economies. But the interesting thing is once you get to the counter, typically the pharmacist would have to go get an approval from the insurance company, which is by itself a 15 to 20-minute process. So very often now they tell you, please come back in half an hour. So overall, the experience is quite horrific. There's a lot of fraud because everything is handwritten. Anyone can pretty much fake a prescription. Insurance companies anecdotally say that fraud is about 15 to 20% of policy utilization, which in an industry that is making 9 to 7% margin is a problem. So lots of room for improvement. Now, the hypothesis that we started the company with, we wanted to predominantly kind of tackle the medication journey. We felt this is kind of big enough by itself. Medications alone constitute around 30 to 40% of healthcare spend in general. And we were very much inspired by the PBM model that had emerged in the US in the early 2000s. The thesis was, we don't believe pharmacies in their current format, as they exist today, are relevant and are going to exist in 10 to 20 years from now. There's going to be room for a new breed of players, or call it pharmacy benefit platforms, call it whatever you want. It hasn't been coined yet, really, the term. But really, that does three things very, very well. One, they're able to move medications from pharma to the consumer's hand at the cheapest and fastest possible price. So you can call it a direct-to-distributor play, whatever it is, just getting the benefit of the margin and kind of the fast transportation, which does not really require a retail store anymore if everything's delivered to the consumer's home. Two, it's a company that is inherently digital, that is integrated with insurance companies, understands approvals automation, and understands claims processing, which today none of the pharmacies do, because in the future of healthcare is that you have insurance sponsors at the end of the day. And three, is able to engage the consumer digitally and acquire customers digitally and make sure that it's a pleasant digital experience, which again, pharmacies today inherently do not do. Okay, sorry, I'm trying to figure out how this works. Okay, great. I'll just tell you quickly kind of what we did as a company over the course of the last 3 years. So we started out with an MVP in 2018, just simply launched a very simple app where people can browse for medications, upload prescriptions, and build a small marketplace of pharmacies that we can deliver from, just to make sure we get regional coverage. What we wanted really to test at the time, is the Egyptian consumer ready to engage digitally when it comes to prescriptions and medications and so on? Because we needed to align ourselves with the consumer or the insurance companies, but the consumer felt like the kind of natural first step. Within a few months, we had a few thousand orders. That went well, so we kind of got serious about the company, and we started to approach insurance companies to be able to integrate with them, automate, make sure people don't actually have to go to the pharmacy. We approached AXA end of 2018. We started working 2019. From there on, really, it started to flow. We got, after that, kind of all the multinational insurance companies on board. Our proposition to them was really kind of, we'd be able to disintermediate between consumer and pharmacy, so we remove fraud. And two, we save them a lot of money because we're able to route orders in a way that maximizes their rebates and so on, and improves COGS by about 5% in medications, which is quite significant for an insurance company. We got our seed funding in 2019, started to build the company, went on throughout 2020 to build a network of about 2,000 pharmacies across the country to cover the country geographically end to end. We developed and rolled out our own approvals automation engine that is now deployed with 5 insurance companies. So not only do we process orders, we also give them the SaaS to be able to completely automate the approval or the interaction process between them and the pharmacy. To date, we have about 80% automation. So 80% of the prescriptions that are entered on the spot receive an immediate answer, whether with approval or rejection or partial approval. And in 2021, after our second round, we basically built our own supply chain, again, going kind of direct to distributor, being able to get the full margin and delivering to the consumer's hands. At the moment, we're working with 80% of the insurance companies in the country, either by offering a value-added service to their members or by direct assignment where we are managing chronic populations end-to-end. Thank you. That's it from my side. Thank you very much.